So this client is 70 years old. He's had procedures done in the past, namely a rhinoplasty. He's had a number of filler procedures done as well. What he'd like to accomplish is just to get a little bit more volume in his cheeks, especially anteriorly, and he would like to masculinize his jawline. So that's what we're going to do. So we're going to do an injection, and I'm going to do a needle injection onto the angle of the mandible to give him more volume. And then what I'd like to do, and again, males are different than females. In males, I'm just going to turn your head, you want to keep the cheek flatter. So you don't want to over augment. What I'd like to do, whether it's male or female, and again with a needle tip injection, is I'd like to inject into the deep medial fat pocket. And when you do the deep medial fat pocket injection, and the deep medial fat pocket is responsible for the volumization of the cheek. And so if you can reinflate it, it essentially just gives you a much nicer, more fuller look in this whole area. So we're going to do a pinpoint injection onto bone into the medial fat pocket, deep fat pocket during his injection. Good. All right, so what we're going to do is we're going to do the anterior projection of the cheek. And so to accomplish that, what I like doing is to go right into the superperiosteal plane, utilizing shape again. And what I want to do is I want to augment the deep medial fat pocket. I think that's the most important fat pocket to correct if you want to give a nice shape to the cheek. Again, males tend to have a flatter anterior cheek, but certain males want to have a more fuller look to that area. So we did 2 cc's per angle of the jaw, and then we did 1 cc per cheek. We're gonna have him take a look, but I think he should be happy with this outcome, and we can really appreciate that once we look at the preoperative or pre-procedure and post-procedure pictures.